There are so many common problems that people have with their eyesight, me included with that, and vision can affect more than our eyesight, but there are therapies out there that could help you.
That's right, and here to tell us about them is Dr. Amy Thomas and Karin Zabriskie with Arizona Vision Therapy Center. Thanks to both of you so much for being here.
Thank you.
Such a pleasure. Dr. Thomas, starting with you, you've been on the show numerous times, but if vision therapy is new to someone watching, what do you do there?
Okay, so that's where I teach people how to use their eyes to get them to work together as a team. So frequently people, they don't even start out at my office. They start out at regular eye doctors. And they have problems with, they got all kinds of headaches, and they got strain, and they've got dizziness, nausea sometimes, problems with coordination, and a whole bunch of problems trying to concentrate on what they're doing. They go to the eye doctor tries to get them a pair of glasses. Most of the time they work, right? But there's this little bit of the population where they're just struggling with what they got, and they have no idea what to do next. So they come over to my office, and I have a whole bunch of things that I can do to help them. One of them is the vision therapy that you're talking about, to teach them how to do everything the easy way. The other one is those neuro-optics lenses, where I get them the most comfortable pair of glasses possible. But every once in a while I run into something that's just out of the ordinary that needs to be put back into place before they can have nice comfortable vision. And quite a bit of the time that's the spine and the skull. So this is where I want to introduce Karin Zabriskie here. I coordinate with her very frequently because most of my patients actually do have something going on in their spine, the spine and the skull, that's just not lining up like it's supposed to. So she's going to kind of
Sounds like there's so many steps involved in this.
I know.
She's going to give us a visual, right, of how this works, okay?
Yes, it's fascinating.
Yeah. So I'm super excited to be working with Dr. Thomas because we realize that what she does and what I do has to potentiate each other really well. So structural energetic therapy treats the whole body and creates a balance and function from head to toe. I work with headache, sciatic pain, children with autism, all sorts of different things that starts from the cranium. So if you look at the cranium, there is a correlation between the cranial bones and the pelvis, which then goes to the whole structure of the body. So this suture right here is called the sagittal suture, and it represents the spine. This bone here is the occipital bone. If I were to turn that upside down, it's basically a mirror image of your sacrum.
Excuse me.
All connected.
All connected. So in many people there is an imbalance or a little bit of a core distortion where the pelvic bone, the left side, is tilted forward, which corresponds to the sphenoid bone that's also tilted forward. So what I do with structural energetic therapy is create a balance with the cranial bones first, and then the rest of the body responds to that. It starts from the cranium. So if you look at the bottom of the cranium and think about it as a pelvic floor, you can say that these orange guys are your hip bones, and then you have your sacrum in the back.
Wow.
And Dr. Thomas can talk more about how the eyes.
Yes, because it seems so strange we're talking about them, we're talking about hip bones, but we're actually talking about eyesight in the beginning.
Yeah, so if there's any kind of rotation to that area right there, it can actually make the eyes much more difficult. In fact, I'm going to go over this real quick.
Yeah, go for it.
All right, so imagine this is right here. You go like this. All right, okay, so these are the eyeballs right here.
Okay.
And this is the brain, and this is the spine right here. So if everything's nice and lined up, you can move your eyes like you need to, and you can cross, and you can do your stuff.
Right.
Second something comes by, you end up having a whole bunch of problems getting your eyes to line up and to work together as a team again, right? So you have to get rid of those restrictions, get everything back up and running, and that's what she does.
And I use muscle testing, very simple, and the work I do is also completely pain-free. Most people, I put a lot of people to sleep on the table, let's just put it that way.
And you're very relaxing at the same time.
Yes, yeah, it's very rewarding, and we have seen some nice improvements working together.
You touched on some of the people who can benefit from this, and autism stuck out to me. How so?
Yeah, because in many cases with kids with autism, they have tension and pressure behind the frontal bone, which is in some cases related to swelling. So with the cranial manipulations, very gentle again, I can help decrease that swelling and allow them to have less headaches, and sometimes cognition improves, and they get calmer.
And doctor, this is all to say that if someone had just visited a regular eye doctor, not a vision therapist, they never would have known that all of these issues were there and how to fix them.
Right.
So that's why people need to see a vision therapist.
Did you have time for examples? because
We are actually out of time, but you guys did an
Okay.
incredible job.
Okay.
It's such a fascinating demo. It really was great. Thank
Yeah,
you.
and
Okay.
we love how you continue coming back.
Yeah,
so
please
that's
do.
good. All right.
Come back and tell us more.
And Arizona Vision Therapy is now offering 30% off of their visual skills exam when you mention the Morning Blend. So give them a call at 520-886-8800 to make an appointment by March 9th to take advantage of that special offer. Or you can visit their website, azvisiontherapy.com, for more information.